High-yield, integrated clinical scenarios are a cornerstone of the USMLE, challenging examinees to apply knowledge across multiple medical disciplines. These cases often blend concepts from pathology, pharmacology, physiology, and more, reflecting the complexity of real-world patient care. Success in tackling such questions relies on a systematic, step-by-step approach to reasoning. By carefully analyzing each detail and linking findings to relevant concepts, test takers can navigate mixed subject cases with greater confidence and accuracy. Developing this methodical mindset is essential for both exam performance and future clinical practice. A 65-year-old man presents with severe chest pain and electrocardiogram findings showing ST elevations in leads 2, 3, and a VF, indicating an inferior myocardial infarction. He soon develops low blood pressure, clear lung sounds, and elevated jugular venous pressure, which point toward a right ventricular infarction. In this situation, it is crucial to avoid medications like nitrates that can further lower his blood pressure. Instead, careful administration of intravenous fluids is recommended to support his circulation. These management steps help stabilize the patient and address the unique challenges of right ventricular infarction. Dye-George syndrome is a genetic disorder that arises from abnormal development of the third and fourth pharyngeal pouches during embryogenesis. This leads to a range of clinical features, including congenital heart defects, low calcium levels due to underdeveloped parathyroid glands, and absent T cells resulting in recurrent infections. The absence of T cells highlights the immunological impact of the syndrome, as the thymus fails to develop properly. Tetany, or muscle spasms, occurs as a result of hypocalcemia. Together, these findings illustrate how disruptions in early embryonic development can have widespread effects on multiple organ systems. A patient presenting with confusion, fruity-smelling breath, and significantly elevated blood sugar levels is diagnosed with diabetic ketoacidosis. This condition is characterized by a low blood pH and reduced bicarbonate, indicating a state of metabolic acidosis. The presence of an anion gap further supports this diagnosis, as it reflects the accumulation of ketone bodies in the blood. Potassium levels can be misleading in this scenario, as total body potassium is often depleted despite normal or elevated blood test results. Understanding these dynamics is crucial for effective management and treatment of diabetic ketoacidosis. A patient recovering from burn injuries in the hospital begins to show signs of fever and produces green-colored sputum. This unusual coloration is a key indicator of infection by Pseudomonas aeruginosa, a bacterium known for its distinctive pigments. The green pigment, called pyocyanin, is a hallmark of this organism and helps clinicians quickly identify its presence. Pseudomonas infections are particularly concerning in burn patients due to their compromised skin barrier and increased vulnerability. During tuberculosis treatment, some patients may experience peripheral neuropathy, a condition characterized by numbness or tingling in the hands and feet. This side effect is often linked to isoniazid, a common anti-tuberculosis medication, which can cause a deficiency in vitamin B6, also known as pyridoxine. The deficiency disrupts normal nerve function, leading to the symptoms of neuropathy. To address this, healthcare providers typically recommend pyridoxine supplementation, which helps restore vitamin B6 levels and alleviates the nerve-related symptoms. A patient presents with a harsh systolic murmur that radiates to the carotid arteries and episodes of syncope. These findings are classic for aortic stenosis, a condition where the aortic valve becomes narrowed, restricting blood flow from the heart to the rest of the body. Aortic stenosis is often identified by a clinical triad: syncope, angina, and dyspnea. The combination of these symptoms, along with the characteristic murmur, helps clinicians make an accurate diagnosis. Early recognition is essential, as this condition can lead to serious complications if left untreated. A patient presenting with resting tremor, muscle rigidity, and slowed movements is diagnosed with Parkinson's disease. This condition is characterized by the progressive loss of dopamine-producing neurons in a region of the brain called the substantia nigra. Dopamine is essential for smooth, coordinated muscle activity, and its deficiency leads to the hallmark symptoms observed in Parkinson's disease. Understanding this underlying mechanism is crucial for developing effective treatments and managing the progression of the disorder. A patient presenting with anemia, hypersegmented neutrophils, and neurological symptoms is most likely suffering from a vitamin B12 deficiency. While both vitamin B12 and folate deficiencies can cause similar blood abnormalities, such as anemia and hypersegmented neutrophils, neurological symptoms are a distinguishing feature of vitamin B12 deficiency. These symptoms may include numbness, tingling, or difficulties with balance. In contrast, folate deficiency does not typically lead to neurological issues. Recognizing these differences is crucial for accurate diagnosis and appropriate treatment. A young patient presents with episodes of wheezing, which noticeably improve after using bronchodilators. This pattern is characteristic of asthma, a condition marked by reversible airway obstruction. The ability of bronchodilators to relieve symptoms highlights the underlying airway hyperresponsiveness. Asthma often manifests in childhood and can vary in severity and frequency among individuals. Marfan syndrome is a genetic disorder that affects the body's connective tissue. Patients often present with a tall stature, unusually long limbs, and fingers, a condition known as arachnodactyly. Lens dislocation in the eyes and the development of aortic aneurysms are also common features. The underlying cause is a defect in the fibrillin protein, which compromises the strength and elasticity of connective tissues throughout the body. Early diagnosis and careful management are essential to reduce the risk of life-threatening complications. In this scenario, the patient presents with chronic kidney disease, which disrupts the body's ability to maintain mineral balance. As kidney function declines, phosphate accumulates in the blood while calcium levels drop. In response, the parathyroid glands secrete more parathyroid hormone, or PTH, in an attempt to restore balance. This compensatory mechanism, known as secondary hyperparathyroidism, often leads to bone pain and further complications. The case highlights the intricate connection between renal function and endocrine regulation of minerals in the body. A patient presenting with blood in the urine after a recent sore throat raises concern for a kidney complication. Upon further investigation, immune complex deposits are found in the kidney tissue. This leads to the diagnosis of post-streptococcal glomerulonephritis, a condition that often follows a streptococcal infection. The underlying mechanism involves a type 3 hypersensitivity reaction, where immune complexes trigger inflammation and damage within the glomeruli of the kidneys. A patient experiences sudden shortness of breath following a lengthy flight, and imaging confirms the presence of a pulmonary embolism. This condition arises when a blood clot travels to the lungs, obstructing blood flow. The underlying mechanism is explained by Virchow's triad, which highlights three key factors: blood stasis, endothelial injury, and hypercoagulability. In this scenario, prolonged immobility during the flight leads to stasis, increasing the risk of clot formation in the deep veins. Once formed, these clots can dislodge and travel to the lungs, resulting in a potentially life-threatening embolism. A patient presenting with hypertension, low potassium levels, and metabolic alkalosis is found to have hyperaldosteronism. This condition is characterized by excessive production of aldosterone, a hormone that increases sodium retention in the kidneys while promoting the loss of a potassium. The resulting imbalance leads to elevated blood pressure and disturbances in the body's acid-base status. Recognizing these clinical features is crucial for accurate diagnosis and effective management. A patient arrives with a combination of fever, anemia, low platelet count, and the presence of schistocytes on a blood smear. These findings point toward a diagnosis of thrombotic thrombocytopenic purpura, or TTP. This rare but serious condition is caused by a deficiency of the enzyme ADAMTES13. Without enough of this enzyme, small blood clots form throughout the body, leading to the observed symptoms. Prompt recognition and treatment are essential to prevent severe complications. Integrating clinical reasoning across multiple disciplines is essential for effective USMLE preparation. This approach not only reinforces foundational knowledge, but also enhances the ability to apply concepts in complex, real-world scenarios. By connecting information from various fields, students develop a deeper understanding and improve their problem-solving skills. Ultimately, mastering interdisciplinary clinical reasoning leads to higher exam performance and better prepares future physicians for the challenges of patient care.